In this week's Mommy Minute, more cases of pertussis, better known as whooping cough, are being reported throughout the U.S. And if you haven't been vaccinated for it, now is the time, especially since the respiratory infection can be contagious.
Even though most of us, and really all of us, should be vaccinated for whooping cough, we still do see spikes in cases about every 3 to 5 years. We think the past few years we've been treated to this less than the number of average cases, probably because of the pandemic and wearing masks, being more careful when we're sick, and that's probably created less spread of whooping cough.
Dr. Donald Dumfer is an infectious disease specialist for Cleveland Clinic. He says whooping cough is spread when an individual who is infected coughs, sneezes, or breathes close to another person. Early symptoms may look like those of a common cold and then typically progress into persistent and violent cough. The coughing episodes could last for weeks or even months. Babies under 6 months old are most at risk for whooping cough. Symptoms for that age group include coughing and difficulty breathing, which can be life-threatening. As for prevention, Dr. Dumford says vaccination really is key.
The one group with vaccination that we really need to focus on is pregnant patients. So the average patient, that recommendation is going to be get your Tdap vaccine, every 10 years. However, because infants are at such high risk, especially in those first 6 months of life, it's recommended that anybody who's pregnant gets that pertussis vaccine in the form of a Tdap with every pregnancy.
He says there are antibiotics available to treat whooping cough, but they only help with preventing further spread. Coughing fits have to be treated separately with other remedies. Stay with us. We'll be right back.